Hello, my name is Karis. I'm a BCBA. I'm here today with Bianca, who's the mother of Isaiah. This is one of the kiddos that we're going to hopefully start treatment with shortly. So I just kind of want to go over some documents that we've discussed recently. I've gathered some small information pieces from the IEP regarding a low academic performance based on chronological age with lower communication impairments and sound sensitivity. Based on the social assessment, there was little to no information that was gathered from that other than a very low desire to interact with others, especially peers, and difficulty attending to any form of conversation. After the diagnostic information was read through, it did include an autistic diagnosis. However, further information was little to none. We're going to go ahead and get into some questions with being able to kind of go more in depth on things that we need to discuss. Hi, Bianca. Thanks for joining us today. How are you doing?
I'm doing good. How are you?
Good. Do you have any questions so far about anything that I've discussed that we've already went over?
Nope.
Perfect. All right. So we have your little boy named Isaiah. He's currently 5.5. Can you just go ahead and describe his language abilities based on kind of 1 word, 2 words, fluency, verbal, things like that?
Yeah, so he typically talks to us with like 1 or 2 words, depending on the item that he wants or like what he needs our attention for, but it's typically 1 to 2 words, nothing more. If it's anything more, it's kind of like, I can't understand him.
Okay. And does he attend any school now, private, public, homeschool, anything along those lines?
Yes, we actually have him in a all-day program. He works, it's all in an all autistic school. So they do different like subjects, sensory stuff. However, I haven't really seen much improvement. If anything, I just feel like he needs one-on-one rather than a classroom just because he can't attend much.
Okay. What about his play skills? Any preferred toys or leisure activities that you can kind of go over what he kind of navigates towards?
Yeah, so with his siblings, he doesn't like to play with them. He likes to kind of play by himself. If his siblings are playing with him, he kind of gets frustrated just because he likes to be by himself and likes to like line up his toys. He really likes cars and dinosaurs.
Okay.
He's been on a theme for farm animals recently. At school, teachers tell me that he is typically by himself, that he doesn't really like to play with his peers.
Okay. Thank you for that.
Mm-hmm.
And right now, is he currently taking any medications?
Nope.
No medications. Okay, perfect. All right, now we're going to kind of discuss any problem behaviors. Do you see any of those behaviors and what kind of do they look like?
Yes, so he has self-interest behaviors, his SIB. It's in pretty worse, like I feel like as of late, just because we don't, especially when we can't understand him, he gets really escalated, so to the point where like sometimes it leaves a lump or a bruise on his head.
Okay. Is that kind of the only behavior you would kind of see, or is that what you're most concerning?
Physical aggression too,
Okay.
with his peers, especially his siblings, his younger one. And then PA towards us if we are trying to like redirect or like.
Okay. And then what would you kind of consider your most concerning? Which one are we kind of worried about the most right now? Are they pretty equal?
I would say pretty equal just because the SAB is pretty bad and then the physical aggression with his little sister is really bad.
Okay. And then kind of based on the intensity of the behavior and the extent, kind of how would you say he is kind of injured, or if anybody else is injured in the process, kind of what does that look like?
Yeah, so for SAB, I would say on like a worse day, like our pretty bad day, like he will continue hitting his head, even if like I try to block, like it takes us a long time to like de-escalate him / calm him down. So typically it like breaks my heart, but like you'll see like little lumps on his head if he's having like a really hard day. I hate saying like if it's a good day, if he does have one, but it's typically like 1 or 2 like bumps on the head. He usually mainly uses like the floor if he's really frustrated and obviously doesn't have the floor. He uses his hands or his fists.
Okay. And do you see any kind of hands, fists against the head of other individuals, or does physical aggression kind of look like pushing, pulling, any biting?
Pushing and pulling, and if his little sister's playing with his toy, he'll try to bite her.
Okay. All right, and kind of a little bit more about the problem behaviors. I know you kind of said it occurs pretty frequently. Does it seem to occur in busts or clusters?
When he's having like a really hard time, especially his SIB, his self-injurious behavior, yes, like if he's having like a really hard weekend, I can see a lot, and then sometimes we have like a really good week, it's not as much, but yeah, there's
Pretty
some days-
sporadic.
Yeah.
Okay. And then under what conditions or situations do you see these problem behaviors occur? I know with siblings, you said based on toys, kind of SIB, kind of where does that begin?
Yeah, being redirected, being denied access. Peers for PA, it's usually with toys, and then like when peers approach and like don't give him space, he's like, will tend to like push them away, like, hey,
Okay.
I need some space. With us, it's more of like, doesn't like being his diaper changed, so when we
Okay.
have to transition him to the bathroom, he doesn't like that. And then PA, yeah, mainly towards his sister, if like he's being like something's taken away from him or something's not in line.
Okay.
You can see that as well as like SIB.
Okay. And then do any of these behaviors rely on any particular activities or just kind of play and toys, social play with siblings, things like that?
Play and toys, and then sometimes if we have to take the iPad away, sometimes
Okay.
we'll use the iPad to like help with him going to the bathroom. I try not to use it as much just because it does, excuse me, trigger him to the head bang.
Okay. And then also triggers of the kind of problem behavior. I just want to kind of go over our main points, which is denied access, transitions to the bathroom, peers kind of playing or trying to engage with their toys, any form of redirection, diaper changes, and then with siblings, it's approachment, if he's playing with toys or any type of removal of those toys, correct?
Yes.
Okay. And then what kind of helps kind of alleviate those behaviors kind of when they begin to occur? Is there anything that helps break the routine?
Yeah. It honestly, he's very big on trust. So if he's with someone, some teachers say like if there's fairly new teachers, he gets really like escalated because they don't know him, so they don't know how to like de-escalate him. So me and my husband, with my husband, he's very good with. So my husband, less words are better with him because if you keep talking to him, he kind of gets escalated. So just like getting at eye level, showing him comfort, giving him his like preferred toys, which are like his farm animals or his dinosaurs.
Okay.
Those really help him. But yeah, I would say like less words. However, obviously, like when he is doing the PA towards his sister, like it's hard because like the sister's crying and then he gets escalated. So
Okay.
he doesn't really like loud noises, especially when like they're screaming. He does not like that he starts to scream. So less words, kind of giving him that comfort, like kind of like massaging his back and be like, hey, it's okay. And really like using your hand to like block,
Okay.
and like kind of giving him squeezes on his head.
Okay. And then kind of going into determining the consequences when these behaviors occur, how do others react or how do you and your husband react, teachers, things like that?
Yeah. So at school, the teachers try, it's hard because they don't really say, but teachers, they have like the IEP that they follow that we've seen, so they will try to like intervene, try to help as much as they can. They do talk a lot though, and so that does escalate him, because he's in a big classroom, so I think that would
Okay.
trigger him a lot. So there's so many peers around, so that like escalates him. At home, I'm sorry, what was the question again?
How do you react? So if
How do I react?
siblings kind of react, or you and your husband, kind of how do you guys plan or choose to react in
Yeah.
hopes to kind of alleviate the behaviors?
When it's physical aggression, we kind of just like, hey, like let's use some nice hands, or you can just tell your sister space, because that's just like one word that he can say, space or
Okay.
no. We also show him that like, hey, it's okay if she plays with you, she can play next to you with her toys, this is your toys. Kind of show him like how to play, like she's little, she's always wants to be by him. So we kind of just show her like, this is your little sister, I know you want some space, but like she wants to be by you. So kind of just like warming her up to him.
Okay.
Kind of works, like especially, but like my husband and I need to be there. If not, that's where we'll see like the biting, the scratching, or the hitting.
Okay.
SIB, if he uses his hands, which sometimes that's like, it's more of just like, okay, I'm like frustrated. So I kind of would be like, all right, like I'm getting frustrated. So I have give him a deep breath, some squeezes. He does love tickles too. Tickles and playing peekaboo, try to get him like a little distracted.
Okay.
Yeah, we kind of just like meet him in the middle. You can tell when he's about to get escalated because he'll start to like, you kind of like shake a little bit and make a little grunt noise. So that's like our cue, like, okay, this might get worse. So that's when we like will try to do something to calm him down.
And do you feel that teachers report kind of similar precursors or things like that that are pretty similar across the home in the school setting?
Some of his teachers aren't the best, so that's why. But I would say they do say that he grunts.
Okay.
Or he'll be like you take like a long deep breath.
And then when you are able to intervene with the behaviors, kind of how does he calm himself down, or how are you able to kind of calm himself down? You said tickles, peekaboo,
Yeah.
any preferred songs, things like that.
Loves when you sing Ants Go Marching or Wheels on the Bus. But just singing, no clapping or anything until he initiates it. If he initiates it, then that's like how you know he's happy.
And is that with just voices? Does he prefer the video on an iPad? Does he have a preference?
First, I'll let him like get him like if he allows us to sing to him and I see that he's like calming down.
Okay.
I'll typically sing first and then like when I see that he's calm, I'll typically try to show him the video to calm him down. But first we'll start singing to even tolerate because we've noticed if you just give him the iPad first, he'll throw it.
Okay. And then at school, is there any other precursors or reasons as to why he engages in the behavior? Are they pretty similar?
Similar, I would say it's more PA at school.
Okay. And you said he doesn't like the loud classroom.
He does not like loud classrooms, doesn't like loud noises.
Okay. Does he do okay with individual play?
Yes.
He prefers individual play.
Individual play, he is very smart when it comes to individual play. He can like put farm animals on the farm, know where they're at. He's very particular on how his toys go. He's like already has in his mind where he wants everything.
Okay. Then kind of going into just some final questions here as we wrap things up. What do you think he's trying to communicate with based on the problem behavior? So is there any reason as to why he would kind of engage in the behaviors based on communication? Is he missing something? Is there any form of communication that he uses or that he's able to kind of prefer based on textbook, any type of ASL, any type of AAC?
Using his AAC device, however, since he does have his one word command, I asked for them to not use it with him just because I do want him to start talking. So we have been using PECs at home, which actually does help us a lot.
Okay.
And when he gives us his PECs, like I try to have him say it, like I want this, I want that. What works best for him, like if let's say his PECs, he doesn't have a PECs icon, he'll grab our hands typically.
Okay.
And that actually like helps us a lot because sometimes like I can't read his mind, so he'll grab my hand and walk me to where he needs it. So he's doing really well with that. I think our number one concern is more of like, since he only has those 1 to 2 words, like he can't say like, I want to play or I need space. So I think that's where like our thing is like, he can say 1 to 2 words very well and very clearly. However, if he like adds in a 3rd word, it's like, it's all mixed up. So.
And is the AAC device only located at school? Is that something that they provided? Do you not have one at home?
No, because I asked, no, I kind of want him off of that just because he just started talking, like, I want to say like 2 months ago.
Okay, and now does he attend when you're attempting to kind of pair the words with the icons, with the PECs icons?
A lot.
Okay. And then do you think of the problem behaviors as any form of self-stimulation?
Definitely SIV.
And kind of what gives you that impression?
Especially I say with his hands, because like he'll do it with his hands, and then I feel like if his hands don't give him that sensory thing, that's when he'll start going
Okay,
to the floor. I've also noticed that he'll do it on like pillows and stuff.
okay. Is this prior to engaging with hands or walls, or is kind of hands his first choice?
Hands is his first choice. And then sometimes when he has his pillows, like he'll grab the pillow and push it to his head.
Okay. And do you feel like that's kind of getting more of like a sensory input, like the pressure against his head?
Yeah, that's what we
Okay.
try to give him some squeezes on his head.
Okay. All right, it looks like we're ready to wrap things up here. Is there anything additional you would like us to note or kind of take into consideration while we look back at these?
Just making sure that like he does work very well one-on-one. And that's why I feel like ABA would be good for him.
Does he have any form of aid or additional teachers in his classroom right now?
Yes, he does
He
have
does.
what are they called? Paraprofessionals. He is really close with one of them, and she says that like they're very close, and she doesn't see as many behaviors, but like when she's not there, that's when like things are escalated. And I think
Okay.
because he has that good bond with her.
That stronger rapport and that trust with her.
Yeah,
Okay.
because if he doesn't trust you, I will say that's when you see more.
Okay, so introduction of new therapists or new teachers kind of will escalate these behaviors.
Yeah. Doesn't like when people boss him around.
Okay. All
His
right.
favorite word is no.
No, okay. And you said no, stop,
Space.
space. Okay, those are kind of his key one words.
Yep. Or
Okay.
more time. That's if like he's doing a preferred activity.
Okay,
And I'll be like, hey, it's time for us to like, we're almost ready, like to go, like, let's go. He'll ask for more time. So he's good with that. He knows
okay,
how to like, he can identify his mom, me, his dad, his sister. Really good at pointing.
okay. And is that for kind of manding for things or kind of even playing, like what you're talking about, things like that
Yeah.
in all aspects?
Yeah.
Okay. Any ASL for him, is he able to kind of do any type of signals or things like that?
Yep, he can do water.
Okay.
Water, more food, eat. He's trying to get us to learn how to do the animal signs, but
Okay.
I'm like, all right, buddy, you gotta slow down.
All right, Bianca, it looks like we have gone through all the questions. Is there any additional information or any questions you have for me right now?
Nope.
All right, perfect. We're gonna go ahead and go through this and then we'll touch base with you shortly. Thanks for joining us today.